Liverpool. Isn't it great to be in Liverpool? And it looks amazing out there. So thank you all. Lots of friends in the audience. So it's really lovely that you're here. This is something I've been thinking and dreaming of for a very long time. So I'm absolutely excited that you're here and it's all happening. Today we've got a fantastic lineup of speakers. I'm really thrilled that every one of our speakers has got lots of valuable lessons for us all to learn. We're live streaming thanks to the digital storytelling skills of John Popham here. So there's a link that people can click onto and they can view all the presentations, and we can share the recordings afterwards as well, which is absolutely brilliant. In our last session today, we're going to be asking you for your ideas and thoughts on whether we can be a community of people who champion. If we think social media can actually have an impact on improving healthcare, what can we do about it, whether in our own organisations or collectively? Is there anything we can do? So that's what I want to ask your thoughts on later on in the day. We're using Slido. Has anyone used Slido before? We're big fans of Slido. It means the shy people in the room can still ask questions anonymously if you like as well. So in your browser, put in sli.do, and if you put the code 4868 in when it asks you for a code, you'll see a page. And there's a page for questions, and you can type in any question at any time of the day. You can like other people's questions, and the favourites will rise to the top, so we can put them to the presenters after each presentation. And there's also 3 surveys that are there. The one that's live at the moment is just to see who's in the room. So just to put in what your profession is, and you'll be able to see for yourself on that page the proportion of people who are communications specialists and those who are from other walks of life. I'm clicking, aren't I? Sorry. I'm in charge of the clicker. Sorry, I not realised. So why should we care about social media? Well, we've got hands up. In the coffee break, we're doing a Twitter challenge. Big prize, once again. Basically, the challenge is, see how many people you can recruit to follow you on Twitter. Try and get 2. But if you get more, there might be a prize. So that's the challenge in the coffee break. A little bit about the Innovation Agency. I'm not going to dwell on it, but just so you're aware, we cover the North West Coast, Cheshire, Merseyside, Lancashire, South Cumbria. We connect businesses with the health service, with social care, with academia, universities, third sector. We draw in patients as well for their opinions. It's all about driving innovation in healthcare, basically. This is about me. I had to dig a long way in the loft to find a picture of me when I started. I wanted to tell you that my roots were as a journalist in newspapers. Here I am at the Bootle Times, I think it was, which is long defunct, with, you might not be able to see it there, but there's a manual typewriter. I was actually hoping to find a more glamorous one, but, there you go. So I started off in newspapers, and if you wrote a story in a newspaper, it would go through the hands of your news editor. It would go to a sub-editor, and he might have other sources. He might have other reporters somewhere else reporting on the same story, and he'd put them all together. Then it would go to the chief sub-editor. If it was a big story, if it was a splash, the editor would be involved. There'd be a whole team of people involved, and what you'd written might be very different to what appeared in print. There were a lot of filters before it actually appeared in the next day's paper. Then I went into BBC Local Radio. On the first day, I had a reel-to-reel Ewer tape recorder thrust into my hands. Off you go to that inquest. Ring in at lunchtime for the lunchtime bulletin and give us a report. Do you check the script first? No. Do you hear my interviews before they go on air? No. That was it, live, really scary. The next day I went out with a radio car. There was an unexploded bomb on the banks of the River Trent. I was at Radio Nottingham. Radio car, live reporting, live interviewing, no filters. Absolutely loved it. So we've come a long way. Because now we're broadcasting from our back pockets, aren't we, with our phones, with our devices. Posting content on behalf of our organisations. What a huge responsibility that is. We're the voice of our hospitals, our universities, our companies. And so it's not surprising that many health professionals give social media a wide berth because of that responsibility. But when they do, they're missing out on some powerful tools. So that's what we're here today to think about. How can other health professionals use it as a tool? I am no guru on social media. I'm a storyteller by nature, if you like. I absolutely love Twitter. what a rich source of information and making connections. It's absolutely brilliant. But we are all broadcasters. There's some stats here which I think you're probably all aware of already, that 77% of us have got a social media account. 34% say they'd rather engage with an organisation via social media than visit a physical location. If Facebook is still the #1 way of people connecting, why isn't everybody using it more with their professional peers as well as with patients? And 41% say social media would affect their choice of a doctor or a hospital. 56% of patients say they want their providers to use social media. In the Innovation Agency, we're a network. We're a small team covering a large area. We make connections. We bring people together. We never work on our own. We're always forming collaborations or behind supporting collaborations. Social media is perfect for that. It signposts us. We're sharing best practice. Social media signposts us to where that is. We can help signpost other people to where it is. We can consult. We get feedback. We've done a survey recently on how we're doing. We use social media. And those platforms for patients and professional communities, we've helped set a couple up, or a few up in the last year, one for quality improvement professionals, another one for GPs who are on a course for evidence into learning. So we're setting up social media communities for them. When I was doing a diploma a couple of years ago with the Chartered Institute of Marketing, there was a module on digital media, digital communications. But for years, I've been an admirer of the Mayo Clinic. They've got a social media network. So it gave me an opportunity to really focus on them and to write about them, which is a pure joy. And I recommend, if you haven't heard of their social media network, to go there. They're the #1 hospital in America, and they have a mission in the social media centre, which is to lead the social media revolution in healthcare, contributing to health and well-being for people everywhere. What a fabulous mission. So I recommend you look those up. This is something they did which really captured the imagination. So the director of the Mayo Clinic social media network, Lee Ace, he volunteered to have a colonoscopy, screening for bowel cancer. It was Bowel Cancer Month awareness, I think, Awareness Month. But not only was it broadcast on Periscope, just to sort of allay fears and to raise awareness of the need for this at a certain age, it was broadcast in Times Square. How brave, the whole procedure. And he was interviewed from his bed as well. So it's just a great example of... they do a lot of YouTube, they do a lot of patient communities. We'll learn about a patient community today, actually. They do a lot of webinars. So it's well worth watching. Now, anything else I need to tell you about today? So we're getting into the business of the day now. And